Hello and welcome to another episode of Weekly Health Talk with Brian Mouse. I'm your host, Brian, clinician, educator, and your partner in health. Today we discuss a topic that many women faces silently, sometimes in pain and embarrassment, but one that needs openness and education. How to prevent vaginal infection. How to prevent vaginal infection. This is not just about treating diseases, it's about protecting dignity, comfort, and confidence. Let's unpack the causes, types, and most importantly, the preventive steps that every woman should know. So, let's understand vaginal health. Understanding vaginal health. Let's begin with the basics. The vagina has its own natural ecosystem made up of good bacteria, mainly lactobacilli, that help keep the area clean and infection-free. These bacteria remain in an acidic environment with a pH of 3.8 to 4.5. which prevents the growth of harmful organisms. But when this balance is disturbed, infections occurs. The most common symptoms of infections include itching or burning, unusual discharge, bad odor, pain during sex or urination. But not all discharges means infection, but changes in color, smell, or thickness may be a warning sign. So understanding this natural balance is the first step in prevention. Let's talk about the common vaginal infections. There are about 3 main types of vaginal infections. The first one is the bacterial vaginosis or BV. Bacterial vaginosis. This one is caused by an imbalance of bacteria. Symptoms include gray or whitish discharge with fish odor. This one is not mostly considered as an STI, but more common with new or multiple partners. So the other type of vaginal infection is yeast infection, or what we call candidiasis. It is caused by candida, a fungus normally present in the body. Symptoms include thick white discharge, intense itching or redness. So it is triggered by antibiotics. Tight clothing, pregnancy, or diabetes. So the other type of vaginal infection is trichomoniasis. This one is a sexually transmitted infection or STI caused by a parasite. The symptoms include yellow-green discharge, itching, discomfort during sex. Others include chlamydia, gonorrhea, and pelvic inflammatory disease, of all which also affect the vaginal health. So, knowing the type of infection helps determine the right treatment, but prevention is always better than cure. So, let me run you through why prevention is so important. Vaginal infections, if left untreated, can lead to pelvic inflammatory disease, chronic discomfort, increased risk of HIV or STI transmission, infertility, emotional distress, stigma, and relation strains. Many women suffer quietly, afraid to talk or seek help. That silence must end, and it begins with knowledge and confidence. On this part, I'm going to talk about the prevention tips. Key prevention tips. So, let's dive into 10 practical and proven ways to prevent vaginal infection. 10 practical and proven ways to prevent vaginal infection. The first one is practice proper hygiene. Practice proper hygiene. Wash the genital area with clean, lukewarm water only. Clean, lukewarm water only. Avoid harsh soaps or scented products. Don't scrub aggressively. Be gentle. The second one is avoid douching. Avoid douching. Douching disrupts the natural pH and kills the healthy bacteria. It does more harm than good. The third is wear breathable underwear. Wear breathable underwear. Choose cotton over synthetic fabrics. Avoid wearing tight underwear for long periods. Change underwear daily and after sweating. The fourth practical is practice safe sex. Always use condoms consistently to prevent STIs. Limit the number of sexual partners. Urinate after intercourse to flush bacteria. The fifth is wipe correctly. Wipe correctly. Always wipe from front to back after using the toilet. This prevents transfer of bacteria from the anus to the vagina. The sixth is maintain blood sugar levels. Uncontrolled diabetes increases the yeast infection. So stay on top of sugar control if diabetic. The seventh tip is avoid staying in wet clothes. Avoid staying in wet clothes. Change out of wet hygiene clothes or wet swimming suits quickly. Moisture encourages fungal growth. The eighth tip is use antibiotics wisely. Only take antibiotics when prescribed. Overuse kills good bacteria. Overuse of antibiotic kills good bacteria. It also raising the risk of yeast infection. So the ninth tip is strengthening immunity. Strengthening immunity. Eat a balanced diet, green fruits, yogurt or whole grain. Reduce stress, sleep well and stay hydrated. So the 10th and last tip is regular checkups. Visit a clinic if you notice unusual symptoms. Early detection means faster relief and fewer complications. As we draw closer, let's talk about the myths and facts. Myths and facts on how to prevent vaginal infection. Let's clear up some myths. So discharge. So the first myth is discharge always means infection. That's not true. Some discharges is normal. Another myth is only unclean women get vaginal infection. The truth is infection can happen to anyone, even with good hygiene. The other myth is scented pads and sprays keep me fresh. That's not true. These can actually cause irritation and infection. Another myth is I don't need to see a doctor, it will go away. But always know that delay in treatment can lead to complication. So knowledge clears confusion and helps women make informed choices. Now on this part, let me give you a real life example. Let me share a real story, a real case. A 33-year-old lady came to the clinic with itching and a thick whitish discharge. She had been self-treating with herbal washes and over-the-counter products for weeks without relief. After a quick lab test, we confirmed a yeast infection. With proper antifungal treatment and lifestyle advice, her symptoms cleared in few days. And she said, "I wish I came earlier. I didn't know it was so common. I felt ashamed." There is no shame in seeking healthcare. The real danger is the silence. So the message for men, mothers, and communities. To the men listening, support your partner. Don't encourage her to seek help. Don't support your partner. Don't judge. Encourage her to seek help and understand this is not about cleanliness, it's about biology. To mothers, teach your daughters early about body awareness, hygiene, and menstrual health. Early education prevents late fears. To the communities, let's normalize open discussion on women's health. No more whispering, no more shame. To summarize today's episode, vaginal infections are more common and preventable. Practice proper hygiene. Avoid harmful products and behaviors. Eat well, protect your immunity, and don't delay care. Break the stigma. Talk about it. Teach it. Normalize it. This is not just a woman's issue, it's a community. Health matters. Let's build a society where every woman feels safe, informed, and empowered to care for her body without fear or shame. Thank you for joining me on Weekly Health Talk with Brian Mouse. In this episode, if this episode helped you, share it with someone. One share message can change a life. Until next time, stay safe, stay informed, and stay empowered. This has been Brian Mouse, the clinician.